However you get your news today or keep up to date with current affairs, you'll usually hear the words health and crisis mentioned in the same sentence, and for good reason. After all, there's a plethora of challenges we're facing that are impacting access, quality, and the delivery of care. Let's not duck the scale of the issues and challenges we face. Let me focus on 5. Take demographics. Massive pressures will accrue over the next 5 years from a sharp increase in the over 65s. According to the EIU, for example, roughly 10% of the world's population will be over 65 by 2018. And in Japan, that percentage could be as high as 28%. There'll also be a burgeoning middle class, particularly true in developing countries, as their economies get stronger, with this group of people fueling an increase in demand for health services. Second, there's been an enormous increase in chronic diseases and conditions around the world. In China, the WHO estimates that some 3 million premature deaths currently arise from chronic diseases. Over the next decade and beyond, the demand on our health systems from chronic disease is only going to get worse. Then there's resources, or should I say a lack of them. There's enormous pressure to reduce costs, and an even greater pressure to show more value. A focus and emphasis on outcomes is becoming the order of the day. And by resources, I don't just mean money and infrastructure. There's a real shortage of people, doctors, nurses, health professionals. A shortage just at the time when demand is on the up. Running through all of this is the 4th of my big 5, an increasing lack of trust. Now, it's probably fair to say that this lack of trust is apparent right across society, but it's certainly true within aspects of the health system. And finally, number 5, us, the patient, the consumer. No longer do we want to sit back and be told what to do. We want to play a much more active part in determining our own health pathway. Now, it's easy to be gloomy about all these enormous challenges, to see them as an impossible mountain to climb. But I take a different view. In fact, I'd go so far as to say that we're about to enter a new era in health, as new technologies bring the promise of better value, greater access, and improved outcomes. At PwC, we see a number of new entrants entering the market, a greater willingness of health professionals to try new ideas, and an appetite from patients to embrace new technologies. Different parts of the world are inevitably at different points of the cycle, and there are many alternative health systems used right across developed and developing markets. So there isn't a single answer, no one-size-fits-all. But whichever market you're from, there are likely to be a number of prerequisites required to bring about successful and sustainable change. Embracing the greater use of technology and analytics has got to be up there as a priority. Technology and analytics are going to unlock so much value, from promoting wellness, preventing disease, treating patients in new ways. Creating more flexible and adaptive operating models is also a must. The old premium pricing and funding models, for example, are bound to, will have to change. So third, the industry has to form better and more effective partnerships. That's partnerships between the public and private sectors, as well as across the public and private sectors, sometimes with organizations you wouldn't have thought possible 5 years ago. Fourth, we've simply got to invest much more in talent to deal with some of the serious skill shortages we have. And we need regulatory environments that encourage innovation while simultaneously protecting the patient. And last but not least, we need strong accountability, integrity, and transparency. All this requires new ways of thinking. It demands innovative reform, but that's precisely what the patient wants. People want to be empowered. They want to be more engaged. So it's this combination of individuals adapting and the providers of health solutions adapting that will deliver the promise of better value, greater access, and improved outcomes. But it does require a move from an old health to a new health model. At PwC, we'll be an active participant in helping businesses, governments, and individuals through this transition to a new health model. We'll also provoke meaningful conversations about the new health environment. Ultimately, this is about improving the health and well-being of people around the world, about changing lives. And it doesn't get any more important than that.